Laser resurfacing. Laser resurfacing is the gold standard for acne scar management for many years. Usually we use CO2 or RB-inject laser for laser resurfacing. The mechanism is we create the thermal injury by using energy-based device which will initiate regenerative wound healing process that leads to collagen synthesis. Nowadays, we usually combine with the application of aerosol to enhance the healing process and to reduce the downtime. In Myanmar, majority of people are skin type 4 or 5, so we have limitations of using energy-based devices. In my practice, I usually do moderate fluence with a low density to avoid the post-inflammatory hyperpigmentation. These photos were taken in 2016 and 2017. He had ice pick, pulse scar, and rolling scar. I did CO2 freshening laser for 10 times. You might appreciate the improvement, but I believe if I combine with other treatment modality, I could give better result for him. Collagen biostimulators. Biostimulator is a new trend in aesthetic practice. Biostimulators are injectable with the ability of improve scar texture, volume, and overall appearance by stimulating the body's natural production of collagen and elastin. The mechanism is they are creating subclinical foreign body reaction that leads to regenerative wound healing. Biostimulator can be classified into inflammatory biostimulator and non-inflammatory biostimulator. These are the examples of inflammatory biostimulator available in the market. We have PLLA, which is Scepter. We have Gaussian hydroxyapatite, which is Radius. We have PCL, we have PDO, and now we have PTLLA. Polylactic acid. There are 4 isomers of polylactic acid. Among them, PLLA and PDLLA are widely used for medical application. Compared with the first generation PLLA, which is a regular broken crystal shape, and because of the structure, it gives intense inflammation and slower degradation. In the past, we had experience with granuloma formation with the PLLA. However, PDLLA is seems to be different. It is spherical shape with the inner reticular structure, and it degraded from the inside. That's why it gives less acidity changes and less inflammation. Even though we think PDLLA is safer, recently there is a case report of blindness after injection of PDLLA in Korea. The use of PDLLA is very versatile. It can be used as a skin booster or it can be used as a biostimulator. As a skin booster, we can use for superficial scar texture, and skin quality improvement. As a biostimulator, it can be used for uneven control, deeper scar, and skin laxity. This is the Korean study of PDLLA and microneedle RF for acne scar. In this study, they applied the PDLLA first, followed by microneedle RF every 4 weeks for 4 times. As a result, we can see 35 to 80% improvement of the acne scar in the photo. This is the rolling scar. For her left side, I did treat it with the PDLLA without laser. For her right side, I treated with PDLLA combined with the CO2 freshener laser. So the question is, which sides have better result? For me, the right side, which was treated with combination of PDLLA and CO2 laser, have better result than the left side. Polynucleotide. PN and PDRN are fragments of cell-bound DNA. We can see that PN is a solid form of PDRN and it has additional scaffolding effect. Both of them can increase in fibroblast growth and vitality via A2A receptor stimulation. This is the case of atrophic scar. For this case, I did injection of polynucleotide for 3 times. I can see the improvement, and her atrophic scar became shallow. However, patient satisfaction was 6 out of 10. Azoosome. Azoosom's are very popular these days. We all know that azoosome are extracellular vesicles for cell-to-cell communication. They are very small in size, so they can easily absorb into the dermis. And we can say that azoosome is a complete package that contains bioactive molecule, growth factor, microRNA, messenger RNA, and protein. However, all the azoosome are not the same. The efficacy and effectiveness depend on where the azosomes are derived from. Until now, azosomes are only allowed for topical application. Usually, we use with the CO2 fractional laser or microneedling. This is double-blind randomized split face study. In this study, one side of the face was treated with CO2 fractional laser, and other side of the face was treated with CO2 fractional laser combined with the azosome. As a result, it shows that azosome can give shorter recovery time, fewer side effects, and enhanced efficacy. This is a video showing how to do layered multimodal approach. I started with the subcision by using 21G cannula to cut the scar adhesion from the bottom. After that, I did injection of biostimulator by using cannula for deeper scar. After that, I did injection of PDLLA intradermally for superficial scar. Here, I would like to remind you that PDLLA has 2 versions. Biostimulator version contains larger particles and skin booster version contains smaller particles and lesser concentration. After that, on top of the PDLLA, I did CO2 fractional laser for better result. Finally, I applied the azosome to reduce the downtime and to enhance the better result. Take-home message: for acne scar management, we should treat all layers of the skin if possible. In my presentation, I talk about how to do subcision together with the biostimulator. I believe this combination is very effective. And as for azosome, I do believe they can enhance the skin rejuvenation, they can reduce the downtime, and they can give a better result. I would like to conclude that layered multimodal approach represents a new standard in regenerative acne scar treatment. Thank you.